Today we are going to discuss about listeriosis, means listeria. Listeria is non-spore forming gram-positive bacillus and it is aerobic and it can grow in anaerobic also. Actually it is facultative aerobic and listeria is saprophytic. It can grow in dead and decaying matter and it causes epizoonotic diseases in birds and animals. Listeriosis, which is a serious infection in newborns it causes granulomas, and in pregnancy, in pregnancy it can induce abortions and it can cause bacteremia and meningitis in immunocompromised states like in HIV as we know, and in diabetes mellitus. And human infections, mode of transmission is through food and contact with the contaminated food like raw cabbages especially, and raw leafy vegetables, cheese, uncooked hot dogs like that. And mode of transmission is another route is vertical transmission from mother to fetus. Age, extremes of age, newborn will be affected and old people will be affected. And if we use proton pump inhibitors, this will cause reduced secretion of HCl, so that acid mediated killing of the listeria will be inhibited. So this also will cause infections of listeria and other risk factors like immunocompromised state as we discussed. These are also another risk factors. And listeriosis outbreaks also occurs, and pathogenesis is intracellular survival. It can survive within intracellular, within the macrophage, and it produces pores to the phagosome, so that this phagosome will get lysed and there is no further fusion with the lysosome and there is no phagocytosis. So it can escape from the phagocytosis and successfully survives intracellularly. It causes host cell polymerization of actin, so that it can penetrate the cell membranes and enter into the cell. Cell to cell spread through the epithelium, from one epithelial cell to another epithelium cell it can spread. So clinical intestinal cells are involved in that, because it can enter through the contaminated food. So clinical manifestations will be due to the serotypes which are involved, half A and half B and 4 serotypes. So it can cause a neonatal listeriosis, early onset and late onset of disease will be seen in neonates, and early onset will be seen less than 5 days of the birth, and baby on an average survives up to 1.5 days, and they suffer from granulomas, all over granulomas, and granulomatosis infantiseptica we'll call it as, and microabscesses will be seen all over the body. Late onset neonatal meningitis will be seen greater than 5 days of birth. In early onset we will see neonatal sepsis, in late onset we won't see neonatal sepsis. Meningitis will be seen in early onset. It is not seen in early onset, it is seen in late onset. So in pregnancy we will see flu-like symptoms, and bacteremia meningitis will occur in the pregnant woman, and fetal complications will be abortion and preterm delivery of the fetus, and it will cause early onset of disease like symptoms. So in adults, bacteremia infection in the bloodstream, and meningitis will get inflamed, and sometimes CNS involvement will be also there. So even in kidney transplanted people, after 1 month they will show this listeriosis because of immune suppression. So it causes gastroenteritis as it is through contaminated food, so gastroenteritis will occur. So lab diagnosis will be motility. It shows tumbling motility at 25 degrees C, and at 37 degrees C it won't show any motility because of flagellar changes, and flagella become non-functional at 37 degrees C. And they can ask this differential motility which is seen in which of the following bacteria, and they may give options, and we have to answer it as listeria. Culture, it can grow on blood agar, it shows beta hemolysis, and also can grow on chocolate agar. And selective media will be palcum agar, which is a polymyxin, means composed of antibiotics, so that commensal bacteria won't grow, and only this listeria can grow and can survive within that antibiotics. So, okay, polymyxin, acreflavin, ceftazidimide, and lithium chloride, esculin, and mannitol. Okay. Treatment will be meningitis. We should give ampicillin, which is a drug of choice, for 2 to 3 weeks. Okay, plus and along with the gentamicin we will give, and cotrimoxazole in patients with penicillin allergy. If they have penicillin allergy, we can't give ampicillin, because ampicillin is bacteriostatic and some modification of penicillin. So we should give cotrimoxazole. So we should take the cases with idea of if they have penicillin allergy or not before giving the treatment. So in febrile gastroenteritis, amoxicillin which is recommended. Antibiotics to be avoided are cephalosporins, chloramphenicol, which are not active in vitro, inside the cell, and so vancomycin, linezolid, they are not linezolid, and macrolides and tetracyclines are not recommended. Linezolid we saw in Staphylococcus aureus, MRSA strain, we given linezolid. So that's it guys. Thank you guys for listening to me carefully. Thank you.